Hi, it's Dr. Greg Jantz. We're going to be talking about addiction, codependency, and what is really helping.
Dr. Gregory Jantz is a best-selling author of over 45 books and the founder of the Center A Place of Hope, voted a top 10 center for depression treatment in the U.S. As the pioneer of whole person care, Dr. Jantz is known as the messenger of hope. Now the nation's expert on anxiety, depression, substance abuse, relationships, trauma, and PTSD, here is Dr. Gregory Jantz.
Hi, it's Dr. Greg Jantz. As a counselor and educator, and doing this now over 40 years, my goodness. I just want to share, I like to keep these podcasts brief and to the point. I value your time, and I'm going to just kind of move through this because we have a bright group of folks that listen to this. So we're going to keep it quick, easy, and short. But I want you to know this is a difficult topic. The topic is how to help a loved one who's struggling with addiction. A loved one could be a friend, could be obviously a family member, but we've got an addiction of some type going on. One of the fastest growing addictions is gambling. So let's say we've got gambling going on. Alcohol is very common. Obviously drugs of all sorts. There can be probably social media addiction. I'll toss that one in. But addictions are so strong that a person will choose addiction over people. And opiate example, opiate addiction, fentanyl, a synthetic opiate. One of the things that happens is that addiction, that craving, that intensity is so strong that it will go in and get a pull on your brain, and it's like that's the only thing that matters. Now that's hard to understand. So when we're trying to help a loved one, we've got to put in perspective, proper perspective, that the addiction is strong. It will override people. It'll override nutrition, food, safety. Addiction is paramount. Now, this is something that many families struggle with, and in my notes, it's the balance between having appropriate compassion and not becoming codependent. And that's a hard one. Compassion says, I sincerely, truly care, but I will not be misused, and I will not let the addiction control me. Compassion says, I will not allow the addiction to control me. And now, the person who's the addict, it's all about, obviously, power and control and getting what they want. But as we look at this, okay, I'm going to be compassionate. What's that look like? Versus codependent. Codependent is, they came to me, begged for money. I knew better. I shouldn't have done it, but they promised it was going to go towards food. I gave $20, and I knew immediately what I had done. Wasn't tough love. It was, I'm codependent. And codependent not only comes in the money form, but codependent will come and I rescue them. Somebody asks how they're doing, and I say they're doing wonderful. I cover up for them. That's codependency. A lot to say about codependency. Big topic. I did a wonderful little book here called Am I Codependent? This book, some good surveys, questionnaires, but how do I get out of a dependent relationship with an addict? Am I codependent? Now, what compassion is not. Here's a few important points. Compassion is not about lecturing. It's not about nagging. It's not about doing those guilt statements. Oh, here we go again. Here we go again. I love you, but here we go again. That's not compassion. Compassion is not hidden judgment. Compassion is not saying, why do you do this again? You know how much I love you. It's not compassion. Compassion is not, I know I shouldn't be doing this, and I know, I trust you, right? So that's why I'm going to give you this $20. I trust you. You're never going to win over the addiction. Compassion will not win. Compassion without substance. Compassionate without courage. So I got to mix compassion plus courage to get to the place of true compassion or tough love. Now, sometimes there's the difficulty in letting them carry their own burden for the choices they've made. Let them carry their own burden. We don't take responsibility for that. Oh, it's so hard. If we're a parent and we're dealing with even an adult son or daughter, and you're dealing with addiction, it's going to trigger all that past love, all that past history, and you're going to work hard to justify doing something that we're going to call help, which is not help. I mean, in our minds, we're going to go, yeah, okay, I know, but he'll get better. Oh, yeah, I know, but she will. Look, I know my daughter. She will do the right thing. No, because you're wrestling with addiction. This is hard because it tears at our heart. We can't, just the pain that this puts us through. So true compassion is true love. Codependency is just that. It's supporting the unhealthy behavior. It's supporting the addiction if I'm codependent. So what does true compassion look like, right? Okay. True compassion, you're going to feel it in your heart. First of all, you're going to know, okay, that was super, super hard, but I know I did the right thing. I know I did the right thing. True compassion says, and I wrote down, it's not about fixing them. We can't fix them. It's not about starving the addiction. You can't. You see, for the addict, addiction is all-powerful, all-controlling. And I, with compassion, can be present in a limited way without enabling. First time I've used that word, enabling. So here's what I'm going to do. I'm going to listen to them without trying to fix their problems. I'm going to listen. Probably not going to offer any advice. I'm probably going to have to say, what are you going to do about that? What is your plan? Versus, oh, if you go and talk to this person, maybe they'll let you stay there. No. That's enabling. All right. We can offer encouragement. I really encourage you. I know this is super tough, but I encourage you. It's time that you take care of this. And I believe you can. Okay, that's an affirming statement of the person. And they may not be there yet, but I'm going to keep affirming who they are because they are not the addiction. Affirming who they are says, I do know you inside of this, and I'm talking to the you I know, not the addiction. You're going to help steer them to the right resources. I'm not going to take them to the right resource unless they say, you know what, I'm so ready. I'm so ready for help. All right. Over here is where the help is. And that's where you need to go. And I'll support you in doing that. There are times that with the help of others, we may take a person to get help because they are asking for it. But we've got to be very careful that we're not falling into deception and enabling the deception, which is enabling the addiction. Okay, so it's similar. I know it may sound odd at first, but it's similar to helping somebody with grief. When we lose a loved one, it's hard. We don't try to take away their pain. We can't. But we are compassionate in our listening. We sit with them. We're there with them, but we can't take away their pain. We can't take away the loss. Same is true with addiction. Yes, I appreciate that you came to me. You've letting me know how bad it is. And what's your plan for that? What are you going to do? Okay, I'm with compassion, I'm putting it back on them. People that get into recovery on their own are starting out ahead. So that's what I want to steer them. So we've been working in the addiction recovery field. It has been over 40 years. And so it is a real, I just want to acknowledge there's a balance at times. There's compassion, codependency, and it's easy at times. Oh, I lean over, I'm being more codependent, and you go, okay, and I make an adjustment. That's how it goes. Also, a loved one has a way of hooking our heart, hooking us to, because they know us, and so they hook us, and when we end up being manipulated, and that manipulation we later regret, we go, oh, I fell for it again. So, here we go. We do know that boundaries are going to be important. The role of boundaries and compassion. Boundaries are not about being harsh or unloving. Boundaries are about being compassionate. It's one of the most compassionate things we can do. Some boundaries are easy to recognize. Saying no to money, for example, that's a clear boundary. Or covering up for somebody's mistake. They're hungover, you know that, and then you just say they're sick, and hopefully they'll be well soon. Okay, that's covering up. Now, a person with boundaries is not being entrapped by that. It's at times it's saying, I'm so sorry they're not here. There are some things going on for them that I'm hoping that they are going to do something about. Ooh, things like that are hard to say, but you're not going to cover up. All right. There's times where there's such a stigma of getting help, and it probably is. And another word for stigma would be shame. It probably is one of the biggest barriers to recovery. Shame plus addiction. I'm ashamed, but I'm talking about the kind of shame that says you feel like something's sincerely wrong with you. You can't be fixed. I'm defective. That's the shame, and that's the shame that hits at the core of an addict. In our compassionate approach to dealing with this addiction and this person in our life, we're going to avoid hurtful labels. We're not going to, you are an addict and you know it. Okay, that's a judgment. So we're not going to do those things. We're going to help them move towards a supportive, accountable recovery community. Yes. And we also need to remember compassion says addiction doesn't define who my loved one is. That's the addiction I'm talking to. Remember, the addiction takes over the personality. It takes over the person. The addiction controls everything. And you go, that's not the person I know. No, it's not, but it's the addiction controlling the person that you know and love. So, being codependent, it doesn't define you either. Because you know what? We learn and we grow and we go, okay, I know that's not healthy. I'm not going to do that anymore. There is times where we're going to have really difficult conversations with somebody that we love. But we're always going to begin it with an affirmation. I care deeply about you, or I love you. I know you're going through, it appears to be an extraordinarily difficult time. I am sorry. Affirmation that equaled compassion. Then I'm going to ask for permission. Can I have an honest, deep conversation with you? Say what it is. Can we have an honest conversation? So you've already gave the affirmation of love, the compassion, and now you're asking permission to share. And then we're just going to stick to the facts. Don't accuse them. Don't tell them they've been stealing money, or But you can say, I've noticed that you're drinking alcohol appears every night, and I'm worried about you. Period. And I'm worried about you. Let them have their response. Give them space to share. So you say, I'm worried about you. You're going to address this in a compassionate way that says, I love and care about you. But you're going to be firm. They may give a lot of excuses. They may say, I'm really not hardly drinking at all. They may deny. They may cover up. And remember, the first thing that a person who's struggling with addiction is always denial. So now we're always going to do follow-up. All right, I'm looking forward to a time where we can talk again, and I'll talk with you more when you're ready. Period. I'll talk with you more when you're ready. You see, at this point, the more we push into it, the more denial, the more lies, the more deception. And I think it's important to understand that an addict may be thinking it's only affecting them, it's not affecting anybody else. It has such a huge ripple effect. And that ripple effect is such that it will cause a person to doubt. You'll start to blame yourself. I failed as a parent. I failed as a dad. This is my fault. It's easy to start falling into that trap. And when you start to feel like it's all your fault, probably a sign you need to talk with somebody, because then we become less effective. If we take it on as, this is probably all my fault. Our family wasn't healthy. This is likely a situation where if you blame yourself, you're more likely to be codependent in the situation. Okay? Compassion, the balance of compassion. Compassion has boundaries. Compassion is firm. And compassion really is, the term used is tough love. Remember, addiction does not define the person, the family. It's a struggle. It takes over. And it is what is very, very powerful. This is why a person who is in recovery, you'll notice that they do at times incredible things to try to save other people's lives because they know the journey they've been on. It could be a food addiction, alcohol addiction, a drug addiction, a digital addiction, a pornography addiction, a gambling addiction. People who recover walk with great courage and with a great message to save other lives. We've got to deal with the whole person. There's the piece that is faith and spiritual, and we know that people who report long-term recovery will say, you know what? I learned a lot of things in counseling and in my treatment, and one of the things that sustains me is my faith in God. And they're rock solid and know that in their faith. They know that that is the foundation. A lot of times we look at relationships. Relationships takes a long time to rebuild trust. And for an addict, a lot of times relationships radically have to change. Old friends who weren't really friends are no longer friends. We start to change our relationships. Those who maybe we burned financially, for example, jobs, our reputation. It takes a while for others to heal. And as time goes along, we rebuild trust and faith and stability and sustainability. And we do those things in our life that we need to do that keeps us on the right point of focus. And we start to look at the whole person, and we start to work diligently to keep that in balance. And that's why if you're dealing with somebody who's in the depths of addiction, there's likely underground, there's depression, there's anxiety, there's post-traumatic stress, there's other issues, there's trauma that needs to be dealt with for the long-term recovery. Am I codependent? Compassion over dependency. I can develop a dependency and this weird dance that we do when a person's an addict, and it's how we've known the relationship. So when there's change, it's change really for both of us. But it's a change that we will never, ever, ever regret. All right, there's a couple different really good on the website, aplaceofhope.com, aplaceofhope.com. Go and look at the upper right. There's a tab that says test. There's some that apply to our topic today that will be both enlightening, and also we were going to automatically forward you some additional information as a place to start. And I know, because we've seen it over the years, thousands of times. Now I couldn't say thousands of times. Individuals who, when given compassion, healthy and consistently, do make a change. They do make a change to restore and rebuild their life, and they never regret it. And so there is hope. Hope comes when there's a plan, and this is a part of building that plan. There's hope.